I'm Dr. Brian Abelson from Kinetic Health.
And Dr. Evangelos Mylonas at Kinetic Health as well.
We're going to talk about treatment expectations today. And this is really, really important because quite often people don't talk about setting expectations. They'll go into a clinic and it doesn't matter what type of therapy they get, whether it's physiotherapy, chiropractic, acupuncture, active release. One of the questions they don't ask is, so what percentage of the people who undergo this treatment are going to get better? And what is your criterion for determining whether or not they're going to get better? So we're going to try and lay it out a little bit for you here. So we're going to talk about something to start out with called the 80-20 rule. And it's actually a pretty simple rule. What we're going to do is we're going to say, okay, if a patient comes in and I examine them and I go through things and I go through the standard orthopedic and neurological tests, and then I look at what my results are, do a little bit of biomechanical analysis, and I come up with a reasonable working diagnosis. Essentially a hypothesis on what we're going to do. And then I correctly apply whatever treatment I'm going to do, and usually a combination of treatments. I would expect to see 80% of people get better. Of course, this is combined with exercise. And you may say to yourself, okay, is that really a good result? Well, actually, it's an excellent result. If we look overall and compare manual therapy to sometimes just, could be pharmaceutical intervention or other types of therapy, 80% is a great result. There's some studies out there in research showing that when people go to just use medications, for example, getting over a neck injury, about 40-some% of these people will get better as compared to, between 70 and 80% per practitioner. So this is a really, really good result. But I would also look at it and say, okay, that means that 20% of people are going to get better. And in terms of my perception, that's not really good enough. So we go to another thing, and we call this trial and error. Now, Evangelos is going to explain a little about this.
Yeah, when we look at trial and error, there's actually a great talk on TED Talks by Tim Harford called Trial, Error, and the God Complex. And he's an economist, and he basically sets it out in a way that, it's a really entertaining lecture, but it makes you think. He's basically saying, through a process of trial and error, you can achieve great results. Now, it is a little time consuming, you got to stick to a plan and try things out. They might not work, you adapt it, you find something that works, you set it out again, you try it in a different way. You're constantly changing, and through that process of elimination, you usually end up with really great results. And it's an honest way, it's an ethical way, and a realistic way to approach problems.
Yes, definitely. The nice thing is that there's actually 7 common factors. So that come into the context of trial and error. We don't just choose random things. We can say, okay, what are the 7 most common things that are reasons why that 20% of people will not achieve the results that they do. Probably one of the most common one is kinetic chain problems. In other words, let's say you walked in the door and you say, I've got a foot problem here. But for whatever reason I went through, your treatments and I did the exercises and yeah, I saw some improvement, but it certainly didn't resolve. That's because probably something else is going on in the kinetic chain. For example, people who come in and they have foot problems, we take them through an analysis and we'll see that their hips are really weak. They do a squat and as they bend down, their hips are coming in, feet going to the side, their arches are collapsing. Their hips are not stabilizing the lower extremity. This is a very common thing. Why don't we talk about some of the other key factors there?
A lot of issues can be traced back to cardiovascular health. We'll have patients come in. I had someone recently with a shoulder injury. They want to get back into the gym and work out that shoulder, but it was far too acute, too painful. And so they asked me, hey, what can I do? How can I start my rehab? And other than just some basic range of motion, I told them, get on a stationary bike, increase your cardiovascular health. By doing so, you'll promote blood flow to the area, capillaries, you'll get more densification, which will allow you to eliminate waste more efficiently, get more oxygen to the tissues that require it, and most importantly, you're increasing your ATP, which is the fuel that your cells use to function. So by doing that, you're going to promote a healing throughout your whole body, not just in one specific area. So there's a lot of things you need to think about and incorporate in the treatment plans.
Absolutely, absolutely. Another common thing is their nutritional status. Quite often people will come in and they're eating junk food, they're eating all sorts of just really, really bad things. They're not getting that protein or complex carbohydrates, no essential fatty acids, and they're basically not supplying the fuel to their bodies to heal. And somehow they think they're going to get over their condition. They are not. If we look at just one factor, fats, a person who eats junk food all the time, they actually become reservoirs of bad fats. Now, that may sound kind of funny, but the fats that you eat actually build up in your system, and you can either store good fats or bad fats. A person who's been eating junk food for a long time, when they have an injury, the level of inflammatory responses in their body is significantly higher as compared to someone else. So nutritional status is a key factor.
No, definitely.
Yep.
And tying into that, you look at a person's weight overall. I mean, you come in and weight's a factor. I mean, you can't avoid it. If there's a back condition or a knee condition, whatever it may be, and you're doing the proper exercise, you're rehabilitating an area, the heavier you are, the more force, the more stress that you'll place on that joint. So reducing your weight, losing those few pounds that you might have gained over Christmas or whatever, I mean, will really help promote healing. And you know, sometimes patients don't want to talk about it, but it's something that needs to be addressed. And I think it's for every pound you gain, it's about a fourfold increase in the joint itself, something like that. So just, you know, losing a couple of pounds, there's 8 to 10 pounds of weight that's taken off a joint. So it really helps healing. Yeah,
it is huge. It is huge. Another key factor is stress. I like this. I'll have people fill out the form when they initially come in the clinic, and just mark some minor things down in terms of, you know, what you consider your level of stress would be. And people will often say, you know, I'm under absolutely no stress whatsoever, or very, very low. And then I'll start to question a little farther, and I'll see that they're working 6 or 7 days a week. They're working 12 to 14 hours a day. They're getting 4 hours of sleep a night. They're going through divorce, but they're not stressed. No, that's not affecting anything. And even asking the question puts them into a state of, you know, adrenaline response. Basically, these people are running around in a fight or flight response. You've got cortisol, you've got adrenaline roaring through their system. I mean, this is really good if you've got a lion chasing you down the street, but you know, it doesn't really happen that much in our normal society. Point being, if your body's going to heal, you need to relax. You need to actually be in a non-stressful environment, and I'm talking about an internal environment.
Definitely, and looking at stress, I mean, it affects sleep, and that's one of the key things that people don't realize is so important to healing. Your body needs to rest. That 7 hours, 8 hours in the evening, whenever it is that you're sleeping, that's when your tissues are regenerating, your mind's setting at ease, you're setting your focus for the next day. Sleep is crucial, and in today's society with, you know, just the way work schedules are, our exposure to different technologies, computers, I mean, people are really not sticking to a good sleep rhythm. It's quite disrupted, and I see it affecting, you know, just your basic functions every day. So it's a key component to any program, any type of treatment.
One other key factor is actually your biological age. Now, certainly I cannot do anything about your chronological age, but there's a heck of a lot you can do about your biological age. Earlier, Evangelos mentioned about exercise and ATP production and increasing cellular energy. Well, for an individual who's not exercising, these are very, very low levels. As we age, our level of energy at a cellular level actually starts to diminish. If we exercise, it comes right back up again. There's a lot of different factors we can actually do about working on our biological age. A person who doesn't exercise, they don't eat well, they don't sleep, they're accelerating all these processes. I talked a little bit earlier about nutritional status. A person who's having bad fats in their diet, basically those bad fats are also inhibiting thyroid activity. And there's several hormones in your thyroid which are related to actually turning back your biological clock. Start eating those bad fats and, you know, your aging starts to accelerate at an incredible rate. So there's a lot of different factors we can look at in terms of saying, okay, yes, 80% of people should achieve great results by doing certain therapies if they follow through with the treatment plan. Well, that could be a problem too. Obviously, you have to show up for treatments and you have to do your exercises. Basically take responsibility for your health. But if it doesn't work out, there's a number of other factors which could be considered. So overall, the results we can achieve, instead of 80%, if you look at these other things, it's probably in the high 90s. So that's good news. There's a lot you can do about your condition.